Presidenti i Kosovës nëpërmjet një statusi në rrjetin social Facebook falenderoi kontributin e Dua Lipës në muzikë. Pas përfundimit të koncertit, këngëtarja nëpërmjet një statusi në Facebook shprehu falenderimin dhe mirënjohjen e saj për të gjithë fansat në Prishtinë. Dua Lipa u shpreh se koncerti në Prishtinë për të ishte një natë e paharruar.
Aty ku ngjarja ndodh.
Çdo transmetimi pa autorizuar është piratimi të drejtës së transmetimit. Pirateria ndalohet dhe ndërshkohet me ligj, sipas përcaktimeve të qartësuara në Shqipëri.
Për këdhelur dhe të qetë. Udhëtimi me anijet tona është një kënaqësi më vete për ju dhe familjen tuaj. Shijoni çdo moment dhe udhëtimi nga Durrësi në Bari do të jetë një ditë e këndshme që do doni ta përsërisni gjithmonë. Për rezervime dhe oferta vizitoni website-in ton venturisferries.com ose kontaktoni me agentët tanë. Venturis Ferries. Paguani më pak, udhëtoni më mirë.
Familja nuk harrohet. Por ka një vend ku zëvendësohet. Për kujdesi, dashuri, trajtimi ngrohtë, të gjitha vetëm në një shtëpi të madhe. Azili, rrezet e jetës.
Shpeshherë, gjërat nuk shkojnë ashtu siç do të donim, por ajo buzëqesh. Dhe kur vjen puna edhe te ushqimi, ajo mund të nxehet ose të buzëqesh. Shëzonja e shtëpisë të buzëqesh, copat, pëlhurat apo tapetet mjafton të jenë Biftex. Biftex, cilësia e qetësisë në familjen tuaj.
Është shumë mirë kur çdo gjë e bën nga divani jot i preferuar.
Dhe ke akses në telefonin tënd kudo. Ne kemi aplikacionin My Vodafone. Kryej thjesht një rimbushje nëpërmjet My Vodafone dhe përzgjidhe ti bonusin që dëshiron, me minuta, SMS, megabajt e shumë të tjera. My Vodafone, My App. Ekskluzivisht
Segafredo.
keni një botë të tërë për të eksploruar. Ne japim 5 GB internet falas me
levar uma infecção de qualquer tipo, localizada, ou seja, uma infecção na pele, você estraga a pele, penetra uma bactéria e pode fazer um processo sistêmico e é mais grave. Também produz um transtorno, o que se chama desbalance hidroeletrolítico, porque está a sair muito líquido do corpo para a pele. Portanto, ocorre um processo de distribuição anormal de líquidos no corpo. Também a pessoa fica chateada, irritada, el proceso cuando se espalha logra afectar lo que es
Pikë Rio de Janeiro. 26 vjeçari mbyll konkurimin në vendin e 6 duke ngritur në 2 garë 326 kg. Ky ishte rezultati i dytë më i mirë në historinë e sportit shqiptar në një vend të tillë, pas vendit të 5 të shtangistit Ilir Suli në Sydney. Madje Salja ngriti të njëjtat kilogram sa peshngritësi pozicionuar përpara Meksikani Mendoza, por ky i fundit përfitoi nga vetëm 21 gram peshë trupore më të ulët. Ngritur 145 kg në stilin e shkëputjes.
Ainda más. A pessoa não pode aplicar algo, como estava a explicar anteriormente. No tomar baño con agua quente, nem sabonete de ningún tipo. A veces los pacientes me dicen, doctor, estoy tomando baño con sabón pH neutro ou sabão de glicerina.
Nada.
Nada. Sabão nenhum tipo.
Somente água limpa e não quente.
Na fase inicial, água limpa e você tem que lavar o corpo, mas deveria ser um gel de banho. Gel de banho é muito menos irritativo.
181 kg.
Arrin të mbaj Brigent Salja, mjaft mirë 181 kg.
Në fund, Salja vendosi në shtang 184 kg, por pa arritur ta mbyllte me sukses provën. Pas përfundimit të garës, klasifikimi i përgjithshëm e shpërbleu me vendin e 6 peshngrisit shqiptar, që pavarësisht polemikave, madje
de alguna forma puede estar asociado. No es la principal causa, de facto es la menos frecuente. Pero una persona que no tenga una correcta higiene en el cuerpo, eso favorece procesos infecciosos, procesos irritativos na pele que van a terminar em um eczema.
E depois de tratado, pode tornar a volta?
Sí. O eczema es un proceso que volta cada vez que los factores condicionantes están presentes. Por tanto, no significa que você por tratar, él no puede voltar. Você só tem que evitar las posibles causas. Lo que estábamos falando anteriormente.
Avatari do të garonte në garën 100 metrave stili lir, por diçka e tillë drejtuese e Komitetit Olimpik Kombëtar Shqiptar për papërgjegjshmëri dhe neglizhencë në këtë rast. Në prag të nisjes së lojrave të Rio de Janeiros, Komiteti Olimpik Kombëtar Shqiptar njoftoi se notari i kuqezisë Sidney Hoxha, në bazë të rezultateve dhe kohëve të regjistruara, do të konkuronte në 2 gara, 100 metra stili lir dhe 50 metra stili lir. Më datë 9 gusht ish programuar gara e 100 metrave. Por Hoxha nuk...
Semilinhoso, folhas verdes grandes, flores hermafroditas amarelas e pode atingir cerca de 3 metros de altura. De origem africana, o quiabeiro é atualmente cultivado em várias regiões tropicais, subtropicais e regiões temperadas do mundo por conter frutos comestíveis saborosos e cheio de nutrientes. Ele foi introduzido
në këtë mbledhje dhe për këtë arsye në mënyrë automatike Sidney është përjashtuar nga gara 100 metra. Mos pjesëmarrja e tyre në një komision teknik tregon një pa përgjegjshmëri, por edhe pa përvojë. Përbën atë që quhet neglizhencë absolute. Sigurisht Federata e Notit mban përgjegjësinë vet për çurin një trajneri të papërgjegjshëm i cili nuk kujdeset as pak për çështjet e rezultateve, për çështjet e këtyre shikimeve të notë
na culinária de várias culturas do mundo. É consumido de várias maneiras, tais como cru, em saladas, refogado, cozido, assado, grelhado e como ingrediente de diversas receitas. Desprezado por algumas pessoas por conter uma gomosidade característica, o quiabo chama a atenção em
të cilët në vend që të merren me çështjet e
É verduras bastante digestivo, então pessoas que estão com problemas, até problemas de úlceras, problemas de gastrite, então ele é uma ótima opção. E combina bem com ovos, feito cozidos. Então tem várias formas de não fazer e sempre aproveitando aquela água daquele cozedor.
Bom, já nos está com mais um convidado ali na show na manhã. Tem a senhora Clara Marques.
Botror I thot jam të mirë lojrave olimpike.
Uma jamba Santa Clara foi dado padroeira de televisão e de todos os profissionais de comunicação social. Papio 12 em 1958. Então,
agora para quem que sabe, que Santa Clara vai para lá na Ruivas.
Sim, porque sim, como minha avó, minha avó e também a igreja onde que está Santa Clara, a imagem de Santa Clara, era a casa de minha avó.
Për femës, ndërsa medalja e bronzit shkoi për Kinë. Kazan Kalmurzaev I dhuroi Rusisë medaljen e dytë të artë në judo. Ai imposhti në finale amerikanin Travis Stevens, kurse në vendin e tretë u rendit japonezi Takanori Nagase.
Tradura Tikita Biramoli, assim, há 6 anos está lida para hoje, se tá mete mais e tudo alguém está fazendo parte de comunicação social, tendo em conta que ele é padroeira dentro dessa festividade ali. Parece que cada dia mas está crescendo mais vontade, está crescendo mais gosto e mas não está aderindo cada vez mais a essa festividade, Santa Clara.
Pois, desde a primeira hora, associá-la, portanto, a todos os profissionais de comunicação social, criando uma comissão que sempre núcleo duro que é
Kanë filluar problemet e organizimit në lojrat olimpike të Rio de Janeiros. Pishina ku po zhvillohen garat e hedhjes ka ndryshuar ngjyrë. Ende nuk është e qartë se çfarë ka ndodhur në qendrën Maria Leng, por pishina nga ngjyra e zakonshme bojqelli është veshur me të gjelbër. Akoma nuk është përcaktuar.
Novidade nessa festa, para nós, Santa Flávia mesmo tem tipo concurso de bolo de cada área.
Pois, na altura do nosso encontro, no Propoba, que tudo órgãos de comunicação social ofereciam um bolo, na fim tinha um júri, onde que estava olhando qual é o melhor bolo. Já sabe, mas já começa dado já sinais de algum bolo, da esperma até mais para o concurso fica mais renhido.
É um incentivo e é
smaller vessels, breaking or hemorrhagic stroke. A second type of stroke is caused by the blood vessels breaking or bursting. The walls of the blood vessels, stretched or weakened by high blood pressure, can break, causing leaking. A balloon or aneurysm can form in a weakened blood vessel.
So this sweet potato, I took a piece like this so nicely. Just put a few of these on there. Okay, that's probably good. Okay. So if you want, you like barbecue chips? You ever eat barbecue chips? Mm-hmm. Okay, so we have a little smoky paprika here. And just
pass through the smaller blood vessels. A TIA or mini stroke is a warning stroke. About a third of persons having TIAs go on to experience strokes within 1 year of the TIAs. People may not even notice that they are having TIAs since they may not last long and people return to normal functioning rather quickly. People may also have many TIAs without noticing. Strokes and heart attacks often occur together.
I blended 2.5 bananas, so we have a little banana puree here. So you want to just put that on, hold that, and you scoop it into the. Perfect. Okay. So we're adding a little vanilla.
Heart muscle dies. In a stroke, the brain doesn't get enough oxygenated blood. Brain cells die. 5 common stroke symptoms. Stroke symptoms occur suddenly. The emphasis is on suddenly. There is no warning. Symptom 1 is numbness or weakness in the face, arms or legs, especially on one side of the body. Symptom 2 is confusion. You may have trouble speaking or understanding others when spoken to. Symptoms.
Chocolate chips? Okay, so we're going to put a lot of them chips today. So these are these cookies. So if you have somebody with an allergy, these are perfect. A little bit more oats in there. Okay, it's a little wet. Now, if you put too many oats in and you feel like you don't have any more bananas and it's not moist,
Just not right. It'll be serious enough for them to go to the ER. FAST. The American Stroke Association uses the letters FAST as an easy way to remember what usually happens during a stroke. F stands for face. One side of the face may droop. A stands for arm. The arm on one side may be weak or even immovable. S stands for speech. You may not be able to speak coherently.
do you know about the magic of television?
Yeah.
You do, don't you? Watch out, this is hot. So there. The magic of television is
clotting. TPA thins clots or unclots. However, treatment needs to be within 3 hours of a stroke. You need to know when the stroke began. You need to take into consideration the time needed to transport to a medical facility. The medical facility must test and evaluate to determine if benefits outweigh the risks. The benefit is that TPA can help 30% of persons with stroke by clotting. The risk is that TPA may not.
I saw you're looking at them. Yeah? Cool, huh? Mm-hmm. Okay. Well, yummy. Makes me want to go back to school with this lunch. So I want to thank you all for joining us today. And
stroke effects and recovery. In this section, we'll go over how stroke affects people, rehabilitation and recovery, going home, and preventing strokes. How stroke affects people. Strokes affect the body, mind, and feelings. Each stroke is different. The effects depend upon the part of the brain that is injured, how bad the injury is, and the person's general health. The first way it affects people is through weakness. With dysarthria knows the right words but has trouble saying them clearly. Being unaware or ignoring things on one side of the body. Often the person will not turn to look toward the weaker side or even eat food from the half of the plate on that side. Pain, numbness, or odd sensations. These can make it hard for the person to relax and feel comfortable. Problems with memory, thinking, attention, or learning. A person may have trouble swallow. Problems with bowel, bladder, and the control. These problems can be helped with the use of portable urinals, bedpans, and other toileting devices. Getting tired very quickly. Becoming tired very quickly may limit the person's participation and performance in a rehabilitation program. Sudden bursts of emotion, such as laughing, crying, or anger. These emotions may indicate that the person needs help. Understanding all day for at least 2 weeks. These always include at least one of the following: feeling sad, blue, or down, and having a loss of interest in things that the person used to enjoy. A person may also have other physical or psychological symptoms, including feeling slowed down or restless and unable to sit still, feeling worthless or guilty, increase or decrease in appetite or weight, problems concentrating, thinking, remembering, or making decisions, or trouble sleeping or sleep. Be treated with medication, psychotherapy, or both. If it is not treated, it can cause needless suffering and also make it harder for recovery from the stroke. Disabilities after a stroke. A disability is a difficulty doing something that is a normal part of daily life. People who have had a stroke may have trouble with many activities that were easy before, such as walking, talking, and taking care of activities of daily living. These include basic tasks such as bathing, dressing, prevent or compensate for any residual disabilities. Rehabilitative therapy begins in the acute care hospital after the person's overall condition has been stabilized, often within 24 to 48 hours after the stroke. The first steps involve promoting independent movement because many individuals are paralyzed or seriously weakened. Patients are prompted to change positions frequently while lying in bed and to engage in passive or active range of motion exercises to strengthen their stroke-impaired. Involved working with specialists for months or years after the stroke. The process of recovering from a stroke usually includes treatment, spontaneous recovery, rehabilitation, and the return to community living. Because stroke survivors often have complex rehabilitation needs, progress and recovery are different for each person. The first steps include helping the patient survive, preventing another stroke, and taking care of any medical problems. Spontaneous recovery naturally rehabilitation. This stage can last for a lifetime as a stroke survivor and family learn to live with the effects of the stroke. This may include doing common tasks in new ways or making up for damage to or limits of one part of the body by greater activity of another. Acute care. What happens during acute care? The main purposes of acute care are to make sure the patient's condition is caused by a stroke and not by some other medical problem. Some people do not need rehabilitation after a stroke because the stroke was mild or they have fully recovered. Others may be too disabled to participate. However, many patients can be helped by rehabilitation. Hospital staff will help the patient and family decide about rehabilitation and choose the right services or program. There are several types of rehabilitation programs. Hospital programs. These programs can be provided by special facility programs are very different from each other, so it is important to get specific information about each one. Some provide a complete range of rehabilitation services, others provide only limited services. Outpatient programs allow a patient who lives at home to get a full range of services by visiting a hospital outpatient department, outpatient rehabilitation facility, or day hospital program. Home-based programs. The patient can live at home and receive rehabilitation services from visiting professionals. Rehabilitation program. The doctor and other hospital staff will provide information and advice about rehabilitation programs, but the patient and family make the final choice. The patient and family may have a preference about whether the patient lives at home or at a rehabilitation facility. They may have reasons for preferring one program over another. Their concerns are important and should be discussed with hospital staff. Things to consider when choosing a rehabilitation program. Does the program provide well are its costs covered by insurance or Medicare? If it is an outpatient or home program, is there someone living at home who can provide care? And if it is an outpatient program, is transportation available? A person may start rehabilitation in one program and later transfer to another. For example, some patients who get tired quickly may start out in a less intense rehabilitation program. After they build up their strength, they are able to transfer to a more intense program. What happens during rehabilitation? Able to take care of oneself with some special equipment. Being able to drive a car is a realistic goal for some, and having a job can be a realistic goal for some people who were working before the stroke. For some, the old job may not be possible, but another job or volunteer activity may be. Reaching treatment goals do not mean the end of recovery. It just means that the stroke survivor and family are ready to continue recovery on their own. Rehabilitation specialists. Because every stroke is different, with disabilities. They provide direct care, educate patients and families, and help the doctor to coordinate care. Physical therapists. They evaluate and treat problems with moving, balance, and coordination. They also teach family members how to help with exercises for the patient and how to help the patient move or walk if needed. Occupational therapists. They provide exercises and practice to help the patient do things they could do before the stroke, such as eat.
We do it island style. From the mountain to the ocean, from the windward to the leeward side.
Prepare any stroke survivor professional staff, such as a nursing home or assisted living facility. An assisted living facility can provide residential living with a full range of services and staff. The choice usually depends on the person's need for care and whether caregivers are available in the home. The stroke survivor needs a living place that supports continuing recovery. It is important to choose a living place that is safe. If the person needs returns. With staff about caregiving and develop a workable plan. What are the stroke survivors' needs? Who can best help meet each of them? Who will be the main caregiver? Does caregiving need to be scheduled around the caregiver's jobs or other activities? There is time during discharge planning to talk with program staff about caregiving and to develop a workable plan. Exercises. Encourage and help the person to make practice skills learned from rehabilitation. Help the person solve problems and discover new ways to do things. Help the person with activities performed before the stroke. These could include using tools, buttoning a shirt, household tasks, and leisure or social activities. Going home to the old home or a new home is a big adjustment. For the stroke survivor, it may be hard to stressful for the family, but it is especially hard if one family member is the only caregiver. Much time may be required to meet the needs of a stroke survivor. Therefore, the caregiver needs as much support as possible from others. Working together eases the stress on everyone. Preventing strokes and healthy living. You can help prevent strokes by making healthy lifestyle choices. A healthy lifestyle risk for stroke. To determine whether your weight is in a healthy range, doctors often calculate your body mass index. If you know your weight and height, you can calculate your own body mass index at the CDC's website. Physical activity can help you maintain a healthy weight and lower your cholesterol and blood pressure levels. For adults, the Surgeon General recommends 2 hours and 30 minutes of moderate intensity exercise. Center for Disease Control Stroke Facts brochure, as well as a stroke quiz that you can take online.
This is Violet Horvath, Director of the Pacific Disability Center. Our for the Hawaii Neurotrauma Registry Project, and look forward to connecting with you. Mahalo for attending our program.
typical children are natural child psychologists, and they sense that this child is different right from the first moment they meet them. Hey! I have very strong opinions based on
Solutions for bullying may vary, but Dr. Atwood offers the key may be with other students.
the only way to stop it is for other children to stop it. Because most acts of bullying are not witnessed by a teacher, but they are witnessed by the other children. And I encourage them to rescue both parties, not just the child with ASD, but the predator, the bully, because if they can
改札がございます。一旦呼びられまして、改札の時間の待ち合わせをお願いいたします。